Hello, I am Dr. Kim Frodel, and in this episode of Conversations with Student Health Service, we will discuss attention deficit hyperactivity disorder, or ADHD. We will also hear from Dr. Riley McGrath of Counseling Services and Adam from the Academic Skills Center. Attention deficit hyperactivity disorder, or ADHD, is often first diagnosed and treated in childhood. Of those diagnosed as a child, at least 30% will continue to have symptoms into adulthood. But what about individuals who are not previously diagnosed and first present as an adult with concerns regarding concentration and attention? This may represent ADHD, but it could also represent several other conditions. An appropriate medical and psychiatric evaluation should be done to ensure the correct diagnosis is made.
So, I'm going to talk a little bit about some of the general symptoms of ADHD and how they might present in college. So, first of all, there's three different types of ADHD. So, there's attention deficit hyperactivity disorder inattentive type, there's attention deficit hyperactivity disorder hyperactive type, and then there's the ADHD combined type. So, it's kind of self-explanatory in the sense the inattentive type is more inattentive symptoms, the hyperactive type is more hyperactive symptoms, and then the combined type is symptoms from both ends. Some of the general presentation of inattentive symptoms: failing to give close attention to details or making careless mistakes. So that could present in the school like really forgetting when things are due or turning things in kind of too quickly without proofreading or looking things over. Difficulty sustaining attention, so not being able to focus throughout class. And that's just not kind of having your mind wander in class from here to there, but really finding it almost impossible to pay attention throughout class. Sometimes people with ADHD, it feels like they're not listening even when they are. So really zoning out a lot, having to redirecting conversation like, hey, are you there? Are you paying attention? Not always following through with instructions. So they might say right away like, oh, sure, I'll certainly do that. And then it totally just kind of leaves the radar. And you might either forget that you agreed to do it or just totally spacing on the idea of what you were going to do. Difficulty with organization is a big piece, so kind of forgetting where to do what, and like just general disorganization in your life. Losing things a lot, just not remembering where you put things. You might even make a to-do list and then lose it. Being easily distracted, so just really having a hard time focusing and paying attention on one thing at a time. And being forgetful in daily activities, often forgetting appointments you scheduled, forgetting to do assignments, things like that can really be a big part of the inattentive piece. The hyperactive piece of ADHD is more like fidgeting, squirming, having trouble staying seated, really having difficulty engaging quietly. So things like reading or just studying with friends might be really hard without getting up and distracting others. Talking excessively, really having a hard time with putting a filter on. Really just if you hear something you relate to, just saying it and jumping in all the time, almost too much, maybe blurting out answers before questions are completed. Difficulty waiting your turn in line, so like really having to move around, not just sit still. That stuff can be hard. And then interrupting others, just like jumping in all the time. Those are some of the common presentations for ADHD. And I think it's important to distinguish that this isn't just doing some of these things some of the times, but it's usually most of these things that you're doing, and they're happening quite often. So it's not something that's like, I think I have ADHD in my math class, but I'm good in my English class. It really presents frequently to be able to be an actual diagnosable disorder.
Thank you, Riley. So, if you have a concern for ADD or ADHD, an appointment can be made with Student Health Service for an assessment. At this appointment, we will screen for other medical conditions by having you fill out a full review of systems and complete forms assessing for depression and anxiety. We will also review your current medication list, caffeine intake, and any substance use. Your personal and family history will be reviewed for heart disease, learning disabilities, and behavioral health concerns. A physical examination will also occur. If we agree that ADD or ADHD may be a concern, we will recommend an assessment by a behavioral health clinician. This can be done in counseling services. After this assessment has been done, we will ask you to return to review the assessment and next steps.
So if you want to do the assessment at counseling services, we have kind of a three-part screening process that we do. And there is a $75 fee for this process. And that really just covers the cost of the testing materials for us. One thing that we do is we give everyone the Conners Adult ADHD Rating Scale. That's a 66-question rating scale that's going to look at a number of different ADHD symptoms and give us an idea of some of the different factors that might be impacting your life, and if they actually do load into a potential ADHD diagnosis. There's going to be an hour-long clinical interview where we'll talk about some of the symptoms and get more background information on what's been going on, how long it's been going on, and what things you've tried before to help, and looking more at the consequences of the behaviors. And then if both of those kind of align and tell us that ADHD seems likely, the next step would be taking the test of variable attention, which is a computerized test that tests your ability to focus. That's a 20-minute test that you have to come into our office and take on the computer, and it really kind of has these boxes that flash in front of you, and you have to click a clicker when you see the box in a certain place, and it does give us a better idea of that actual ability to focus. So that's what it looks like at counseling services when we do the general assessment for ADHD.
Thank you, Riley. Once we've made the diagnosis of ADD, ADHD, then we begin to talk about treatment. So, one step of treatment is thinking about cognitive behavioral therapy. Riley, can you tell us about that?
Yeah, so cognitive behavioral therapy is a great way to assist with ADHD symptoms. Part of it of doing that is really just looking at behavioral interventions for things. So sometimes it's if you're forgetting things all the time and forgetting to what you're supposed to do, it's helping with making lists or figuring out what works for you for setting reminders. Looking at things like exercise, nutrition, the importance of focusing on those. Having just getting a better look at what areas of your life are feeling out of whack, and using some of the CBT techniques to work on some interventions and help improve balance in your life, and improve focus and follow through.
Another part of treatment can be looking into what resources we have available here on campus. Joining us is Adam Fries from the Academic Skills Center to talk about what they have to offer.
Yeah, thanks. So a couple of things about the Academic Skills Center that might be useful. First of all, working with services for students with disabilities is a great place to start in our office in Centennial. They will work with you to create a student visa to help you get accommodations from professors, and anything from testing accommodations to note taking, and even materials in alternative formats, and kind of a whole variety of different resources available. In addition, we have services that we provide for all students that are going to be especially helpful for students with ADHD. Those include tutoring. So we offer a variety of tutoring in most entry-level courses, and in some more advanced courses, and that kind of fluctuates by semester. So always check our website for updates on that. There's also the math lab located in our office in Centennial. You can get tutoring for any math class that you're in. That is currently in person and online, and I believe they're planning on continuing that for the fall. The Center for Writing Excellence is also located in our office, who can help you at, as they said, at any point of the writing process, whether you're kind of stuck in the planning stages or need some help with a final revision. They are excellent at helping with that. And then we also offer supplemental instruction for select classes that are historically difficult. That's a type of group study that takes place a couple times a week with a supplemental instruction leader who will help walk you through and deepen any learning that took place in lecture that week. Some other things I guess one other thing to consider is all of our staff in the Academic Skills Center can work with you, meet with you one-on-one, and help look at what your current academic habits are, what are some areas that we can help you improve and become a more efficient student. And those one-on-one meetings can be set up just by calling our office, and we're more than happy to help out in that way. So some other things to keep in mind as far as when thinking about working online and just kind of being in school in the age of COVID. One thing that I always like to tell students is that place and space really matters. So if you find yourself struggling with school right now, like that makes a lot of sense to me. Being isolated and especially if you're off campus, it can make it really difficult to motivate yourself and want to do all of the things that go along with being a student. It's part of being on campus that's really impactful and I think really important is the fact that every time you walk to class, you're walking past hundreds of other students that are doing the same thing as you. So kind of feeling alone in this is pretty normal, but a couple of things to do to kind of help you through this time. Number one is to set up a workspace at home. And it's really important that this is a workspace and not a Netflix space and not a sleep space or an anything else space. If you can create a space in your house that is only for studying, even if you have, if it is just your dorm room, someplace, your desk where all that you do at that place is study and do your work, that can help kind of trick your brain into being in work mode when you sit down in that place. Obviously, you want to keep this place relatively tidy, and you want it to be relatively quiet so that you can be focused while you work there. Another important thing is to make sure that you're establishing a schedule and building in routines. So this can be as kind of granular or blocked as you would like it to be. But just scheduling in time for work, scheduling in time for breaks, and scheduling in times for meals and exercise. Really important to note here that how you spend your break time is important. So if your break consists of you going or watching an online lecture, it's really important that your break gets you up and away from your computer to kind of give your mind and body some time to reset. A lot of times I'll see students that just sit at the computer again, and their break is them looking at social media on their phone. And that's a fine break, but it's important to get up and move and give your body a little bit of time, like I said, to reset. So another important thing is to make sure that you're making some sort of to-do list. I love a whiteboard right behind my desk for this to help me keep everything visible and organized. But I also like to try and establish a mantra with my to-do list of if I put it on the list, it gets done. So just kind of building in that consistency with how you're using those to-do lists. And then making sure that you're breaking down your tasks into really manageable chunks. And rather than putting your 16-page paper on your to-do list, breaking that down into really small, granular tasks can help motivate you to get some of that stuff done. Obviously, an important step here is minimizing distractions. The biggest distraction working from home is your cell phone. So I'd highly, highly encourage you to put that on do not disturb mode so that it's not a temptation. Put it out of sight. I found that even signing out of social media accounts so that I can't easily click on them to immediately access them puts a good blocking step to prevent me from mindlessly using social media. And then last thing is to kind of avoid that shame spiral. So like I said at the top, being in these times is really difficult for anyone. And it becomes doubly so when you find yourself in a shame spiral and having a lot of negative self-talk and kind of focusing on failures rather than the things that you are doing well and the positive things that you have going for you. So important to know that, you will make mistakes and there'll be failures along the way, but maintaining, a positive mindset and avoiding that shame spiral can really help motivate you.
Thank you. The last part of treatment includes medication. If we decide that medication is indicated, we really have two options for medical management of ADD, stimulants and non-stimulants. Stimulants such as Adderall, Ritalin, and Concerta are used to treat ADD. The effect is noted shortly after taking, and they can be used as needed. Students could take them during the school week and take breaks on weekends or vacations. The stimulants are controlled substances. They require frequent follow-up and possible urine drug screens. An electrocardiogram or heart tracing may be recommended prior to starting due to a black box warning by the FDA for concern of stimulation of the heart. Strattera is the only non-stimulant medication that has been approved for treatment of ADD. It is taken daily and takes 6 to 8 weeks to take effect. Common side effects include nausea and dry mouth. Student Health Service is available to help with the medical management. That is all we have today. Thank you for joining us for Conversations with Student Health Service.